All right, so the eyes are the window to the soul. So when our eyes are looking tired, it causes us some concern. And I always get asked, hey, what can I do about my tired eyes? How can I make them look more refreshed? So let's jump over here and look at this halfway done drawing that I did. So we're going to really specifically today talk about upper eyes. And in the next video, we're going to talk about lower eyes. So I want to hit on the three main things. Three things make our eyes look tired. Okay, the first thing that actually makes our eyes look tired are these crow's feet. So that's the lateral wrinkles that sit out here. And really one of the best ways that we have to get rid of crow's feet are through neuromodulators. And that way is Botox or Dysport, Xeomin, Jeuveau. Also, there are new products being released all the time. The other cool thing that the Botox products do, or the neuromodulators do, is as we Botox these wrinkles down, they'll actually release, and we'll see this eye actually open up a little bit, just a tiny bit. So most of us like to start with neuromodulators to show people kind of how we can open eyes up when we're thinking about moving to surgery, or if we're on the fence of whether or not we want to do surgery. The next aspect of the tired eyes is actually the eyelid itself. Now that gets broken down into two things. We've got loose skin, and then we've actually got our muscle. So one of the ways that we know how is the skin or is it muscle, if it's just sort of hanging over, that's sort of skin. And the best way to sort of explain it is if you're trying to put makeup on and you notice that the makeup is caking and not going on easy, that means that you've got some loose skin there. From a standpoint of what if it's a muscle? So if it's our muscle, we can actually get a little bit of ptosis. And the way that we'll notice that there's ptosis is the eyelid's actually going to sit over the eye itself. So when you look at somebody and their eyelids actually hanging over their eye and they literally can't see, that is a muscle problem. All right. Now, the next thing that actually can happen in this thing is our eyebrows can actually fall so much. And if they fall enough, they're actually, you can see that they're going to push skin down. And that can actually create what looks like an eyelid issue, but it isn't as much as an eyelid issue. Or you may have an eyelid issue, but we also have a brow issue. So how can we figure out if we need to fix the brows? The first way to do is we can actually feel it. So you can actually feel where your orbital rim is. This is your bony rim. And if your brows are below that bony rim, chances are those eyebrows have fallen a little bit. The other way that we can do is we can look over here, sort of this lateral aspect, or sort of to the side of the eye. If you notice when I push my eyebrow down, I start to really collect a lot more skin over here laterally than I do medially. And if you have that, then we need to pull that eyebrow up at the same time then as removing a little bit of skin. So those are the three ways that we would fix tired eyes, going from least invasive to most invasive.